Hello, welcome to the channel Nursing in Handy. This channel is preferably for all the nursing fraternities to have a continuous learning in their profession. So today we'll be seeing about one of the very interesting topic in pediatric nursing, that is baby friendly hospital initiative and under 5 clinic. So before proceeding into the slides, we must know why we have to learn about baby friendly hospital initiative. So even after we are educating to the people regarding the breast milk, breastfeeding, and also we are celebrating the breastfeeding week, but even though of these many strategies, these many programs, these many educations, there are in some part of the countries in global level, the babies are having increased morbidity or mortality rate due to the inadequate breast milk to the babies. So in order to combat that, we must educate the mothers regarding the importance of breastfeeding and also about the colostrum and various techniques and various methods to improve the breast milk production, and also to have a emotional bonding between the mother and child. And that is why we have to learn about the breastfeeding. And also in various hospitals, the BFHI, that is baby friendly hospital initiative, has been launched in order to ensure the effective breastfeeding and also to give knowledge to the caregivers and the society regarding the importance of breastfeeding for both the babies as well as the mothers, and also in society aspect. So and next is under 5 clinic. So majority of the mortality and morbidity rate is increasing in the population, that too in the age group that is below under 5. So in order to combat these all deficiencies and discrepancies, we have to educate the caregivers regarding the nutrition and lifestyle modifications, and also immunization and proper cleaning and sterilization of all the articles, and improvement of ensuring the increase in breastfeeding, and also alternative for the breast milk is breast milk itself. So we have to ensure, and also we have to educate the regarding the breast milk bank is being available in various tertiary care hospitals like that. So baby friendly hospital initiative has launched in 1991. The initiative is a global effort to implement practices that protect, promote and support the breastfeeding. Next is the aims of baby friendly hospital initiative, that is to improve the care of pregnant mother, protect and promote both mother and babies, supporting breastfeeding and breast milk substitutes. So if we consider about the improve the care of pregnant mothers, we have to ensure the mother from the antenatal period itself, we have to educate them regarding the importance of breast milk and also importance of colostrum to the mother as well as the family members. Next is the 10 steps successful for breastfeeding is, that is BFHI. Have a written breastfeeding policy that is routinely communicated to all healthcare staffs. So we should have a written breastfeeding policy, and it has to be educated to all the health personnel who is working in the particular hospital. Train all healthcare staffs in skill necessary to implement this policy. So we have not only give a written breastfeeding policy, but also we have to give them proper training regarding this policy. Inform all pregnant women about the benefits and management of breastfeeding. Help the mothers initiate breastfeeding within half an hour of birth. So once the baby is achieving the breech crawl movement, and once the mother is ready, once the baby is ready, we have to start the breastfeeding as early as possible depending upon the conditions of a mother and baby. So if it is a lower segment cesarean section, based on their level of anesthesia and from the recovery period, we have, as soon as possible, we have to start the breastfeeding to the babies. So only the initial milk is colostrum, that will be fully, it consists of nutritional package and antibodies and immunoglobulins, and the breast milk which contains interferons and also the antibodies like IgG and IgA. So in order to give that full nutritional package to the newborn babies, we have to ensure the breastfeeding to the mother. And also from the antenatal period itself, we have to teach them the benefits and management of breastfeeding practices. So once the baby is born, then only if we educate, it is wrong. Once the mother is pregnant and during her antenatal period itself, we have to impart this knowledge to the mother so that it will be very easy for the mother to adopt to the situation and also give the breast milk to the babies. So the next step is show mothers how to breastfeed and maintain the lactation even if they should be separated from their infants. So we have to educate them the proper positioning of the breastfeeding, and also in some cases the mother and baby is being separated. We have to encourage them to give expressed breast milk so that we can feed the babies in the, for example, if a baby is receiving the treatment in intensive care units, so we have to encourage the mother to give expressed breast milk. Next is give newborn infants no food or drink other than breast milk unless medically indicated. So we should not give any food, that is pre-lactal feeds, before breast milk. We should not give any pre-lactal feeds, that like sugar waters or honey like that. And also practice rooming in, that is allow mothers and infants to remain together for 24 hours a day. That means that we have to practice a rooming in policy. That means we have to place the mother and baby in the same place. That is known as rooming in. Then only we can improve the emotional bonding between the mother and also provide a thermal neutral environment to the babies, and also the emotional bonding, thermoneutral environment that will induce the breast milk. Next is encourage the breastfeeding on demand. So whenever the baby is crying, we have to encourage the mother to give breastfeeding. Next, give no artificial teats or pacifiers to breastfeeding infants. So we should not give any artificial teats or pacifier to the infants. Why? Because the baby will pacify itself by not taking any breast milk from the mother. So in order to avoid that, we have to avoid giving teats and pacifiers. Next is foster the establishment of breastfeeding support groups and refer the mother to the mothers who are breastfeeding. So recommended alternatives, that the World Health Organization recommends that if a mother is unable to breastfeed or chooses not to breastfeed, or if her baby shows signs that isn't getting enough breast milk, a healthy wet nurse or a milk from a donor is a healthy alternative to the formula. So from now and on, what happens is the government has made many various initiatives in providing the substitute for the breast milk. So substitute for the breast milk is breast milk itself. So in some circumstances, the baby is not able to get the breast milk from the mother. Maybe the mother would have expired, or the mother is having any illness, or mother is having taking any medications for the cancer or any radiotherapy. So in that cases, we can opt this breast milk from the human milk bank that is being available in the various tertiary care hospitals. So Government of India has made significant efforts to promote and protect the breastfeeding by enacting a law, the Infant Milk Substitutes Feeding Bottles and Infant Food Act by 1992. This act says that is prohibiting or advertising of infant milk substitutes and feeding bottles to the public, and avoid giving free samplings, hospital promotion gifts. Next is we are going to see the under 5 clinic. So far we have discussed about the baby friendly hospital initiative, that are the 10 steps in BFHI. Now we are going to see the under 5 clinic. So under 5 clinic, why we are more concentrating? Because majority of the morbidity and mortality is being seen in the incidence and prevalence rate is being seen in this population. In order to promote the health of these population, that is under 5 children, we are having a under 5 clinic. That is, this under 5 clinic mainly focuses on care in illness, immunization, adequate nutrition, family planning, and the health education, which comprises of all these care of illness, immunization, family planning methods, and adequate nutrition. So when a baby is having any illness, we have to do a prompt diagnosis and prompt treatment to the baby, so that the health condition of the baby will get improved. In the same way, we have to follow the national immunization schedule, so that the mandatory vaccine has to be vaccinated to the babies. Proper immunization should be done. Next is adequate nutrition should be given to the babies, especially the proteins, fats, vitamins, and also we have to initiate the So till 2 years of age, we have to give the breast milk along with the weaning foods. Next, we have to educate the mother or the caregivers regarding the family planning method, that is spacing between the one baby and next baby, so that their nutrition pattern, their health can be improved. Next, the health education, which comprises of these all things, that is care of illness, immunization, family planning, adequate nutrition, and promotion of physical activities. And also you have to encourage the mother to do a proper cleaning and sterilization of articles, everything, and feeding techniques and weaning techniques and breast milk breastfeeding positions. These all has to be covered in this under 5 clinic, and this all to be given as a health education to the caregivers as well as the public population regarding this all preventive measures and promotive measures on health. Growth and development clinics, that is objectives of the under 5 clinic is prevention of common infections, disease of childhood through immunization, early diagnosis and management of common illness, provide health education regarding the prevention of infection and immunization, that is the national immunization to be given. Then you have to issue the food supplements to the children. Next, care and illness, as we have seen in the under 5 clinic, no, one of the component of under 5 clinic is care and illness, that is diagnosis and prompt treatment of acute illness, chronic illness, and if the baby is having deviation from the normal growth and development, then we have to provide a prompt diagnosis and treatment, then X-ray and laboratory services to be given, and in case if a baby requires any referral services, that should also be inculcated in the care and illness. Next is immunization. So in immunization, we have to immunize each and every babies, that is the national as per the national immunization schedule, we have to immunize it. For example, at birth there will be some doses like OPV vaccine is given and BCG vaccine is given, and at 6 weeks we have to give 6 weeks, 10 weeks and 14 weeks we have to give the vaccines. So based on the national immunization schedule, we have to immunize the babies, and also additional vaccines can also be given by private sectors. Next is adequate nutrition. So adequate nutrition is vital for growth and development of children. Small needs nutrition to develop their organs in satisfying the environmental condition. Baby food is mother's milk at least 6 months of age. So as per WHO, till 2 years of age you can give the breast milk, and up to the 6 months of age you have to give the exclusive breast milk to the baby, and after 6 months along with breast milk you have to start the weaning food or supplementary food to be given, or the complementary food to be started. So based on the baby's conditions, we have to increase the consistency of the weaning food. So initially at 6 months we have to give the liquid foods, then we have to shift to the semi-solid food, then we can give a solid food, and whatever we are giving as a weaning food, it should be freshly prepared, homely cooked, and also it should we should follow the hygiene practices during giving the weaning foods to the babies. And at 8 months of age you can give the finger food, because they will be developing a pincer grasp for that purpose. Next is a newborn baby should come to checkup with a 2-month interval in less than 5 clinic. In under 5 clinic, at 2-month interval we have to go and get the intervention being done. Here they will assess the growth and development as per the age of the child. It can provoke us the future developmental deformities. So when we go and do the assessment only, we can do the prompt diagnosis and prevent the further complications in the future, and deformities can be prevented. The Indian projects have been made in school to improve not only the nutrition but also the health status. So those one of the project is integrated child developmental scheme and under 5 clinics. So these two programs have been implemented by the government in order to improve the health status of the children, that too the age population between below the 5 years of age. So we have to improve their nutrition pattern, immunization pattern, and also we have to assess their normal growth and development. Next we are going to see the family planning. So one of the other component of the under 5 clinic is family planning, which touches all the sides of the triangle, that is care of illness, adequate nutrition and immunization. So we should educate the eligible couple regarding the spacing of the children, and also if we do a proper spacing between the first child and next child only, the health of the mother can be improved and the health of the babies can be improved. And the health education. Under 5 clinic educate about antenatal care, breastfeeding, newborn care, immunization, first aid management, and family planning. So health education, which touches all the sides of the triangle, which comprises of care and illness, immunization, adequate nutrition, and family planning. So breastfeeding, you have to encourage the mother and the caregivers regarding the importance of breastfeeding, and also what all the antibodies, and it is a nutritional package which is present in the breast milk should be taught to the caregivers. And also we have to educate regarding the family planning methods, either temporary family planning method or permanent family planning method. And next is immunization. We have to educate them regarding the national immunization schedule, and also we have to keep tracking the vaccinations. Next is newborn care. So what and all the newborn care can be given, from eye care, cord care, and also we have to teach them regarding the baby bath. Everything we have to teach regarding their these all components, which comprises of breastfeeding, newborn care, immunizations, first aid management, and the family planning methods. Also we have to teach regarding the antenatal care. That means monthly we have to go for the visit, and we have to do the nuchal translucency scan, and also we have to do the anomaly scan, and every trimester we have to go and check the physician and obstetrician regarding the health condition of both the mother and the babies can be improved. Next is the role of nurse. The nurse should be exposed to under 5 clinics, should participate in many programs related to nutritional health education, and you have to have a knowledge regarding the immunization, personal hygiene, deworming programs, vitamin A prophylaxis programs, maintenance of weight chart in the public primary health centers, and oral rehydration therapy, that is ORS, during the dehydration states like vomiting and diarrhea. We have to give the ORS sachets to the patients and also children's, and we have to improve the health condition of the children's by participating these all programs being laid by the government. So we should have a knowledge. So before imparting the knowledge to the public, we should, as a nurses, should have a knowledge regarding these all programs, that is vitamin A prophylaxis program, deworming program, and we have to improve the immunization in the hospital and in the community setup. That is, we have to visit door to door and seek this immunization status. Next, in conclusion, the under 5 clinics provide comprehensive healthcare services to the children under 5 years of age, including the treatment of illness, growth monitoring, preventive cares like immunization, nutrition counseling, and family planning advice for the mother. The clinic's aim is to deliver curative, preventive, and educational services to the communities and the parents, and also improve the family planning methods. So far we have discussed about the baby friendly hospital initiative, that is to initiate the breastfeeding, and the importance of breast milk should be imparted to the caregivers and also to the society. And also we have to encourage about the breast milk, which is a very good essential, and it is a nutritional package, and also it contains abundant amount of antibodies, macrophages, interferons, like that everything is being present in a perfect amount which is being required by the newborn. And next we have discussed about the under 5 clinic. That means we have to educate the parents regarding the improvement of health status of the children, that too in the pediatric population below 5 years of age, and also the under 5 clinic is mainly is to improve the health status, promote the health condition of the child. And also the under 5 clinic, which provides the health monitoring, care of illness, immunization, adequate nutrition, and also family planning methods and health education to the caregivers. So thank you for watching. If you have any doubt, kindly drop down in the comment box. Kindly like it, comment, and subscribe the Nursing in Hand.